Nice to meet you. Nice to meet you, Manuela. And I have few questions for you. I'm very glad to have the chat with you. So let's talk about our workshop, the one we are going to have in November, right? So,
Thank
um,
you, Luisa, for this possibility from IPSIM, for this invitation.
so what is the goal of our workshop? What are you going to explain to us? What are we going to treat with you?
So we are going to give a workshop, which is an experiential but also theoretical training on psychogenealogy and transgenerational therapy using psychodrama and other methods. We have a school that was founded by Anne-Ancelin Schutzenberger. She was our direct trainer, and we started this school 12 years ago, where we teach transgenerational therapy, which is to become aware of what we repeat, what are the patterns we repeat from previous generations, from our ancestors, and also to reinforce the positive legacies we received from our families, because they are very important. These positive neural memories should be reinforced, but also to release the dysfunctional, to transform the dysfunctional patterns.
So we are going to talk about traumas as well. Hmm? We are
Of
going
course,
to treat trauma as well.
yes.
And can you tell me what role does psychodrama play in trauma-informed psychotherapy?
Mhm. Well, trauma-informed psychotherapy is very important, and psychodrama should also be included in those methods, creating a safe space, creating a good relationship with the therapist, with the group, a sense of safeness, enhancing the positive resources before even going to the trauma, uh, and finding what we call in trauma-informed therapy a window of tolerance which is optimal, also giving the people self-regulation mechanisms, because even visiting transgenerational traumas, we can be very triggered or activated or dissociated. So psychodrama really allows us to do trauma-informed therapy, as much as, for example, all the surplus reality, which is the possibility of psychodrama to close the traumatic situation in a better response, to close the unfinished business, to find a way out of this traumatic loop. And
Yeah,
so the
because
whole philosophy of psychodrama is quite, the encounter. I usually bring this style, this Portuguese style, with the symbol of our method.
and can you tell us something more about how can unresolved trauma be transmitted across generations?
Well, there is more and more scientific evidence that it is transmitted. So even this year, Mulligan published an article, a scientific research about the descendants from the war in Syria and the violence in Syria. And it shows that genetic code markers, the epigenetic, is changed from the descendants, the third generations of these original traumas. So we have more and more clinical evidence. We have it since Freud. Freud, Jung, Moreno, they were all speaking about family traumas and collective memory. So also the family therapy studies, and the ones who study specifically psychogenealogy, authors like our teacher Anna Schutzenberger, or Borzo Meninagi, a Hungarian psychiatrist, they all talk about the psychogenealogy phenomena. But more and more we have scientific. Now, I don't know if your question is how it is transmitted, right?
Well,
The how is transdisciplinary. I mean, there are many reasons. There is not just one reason. It can be social learning. It can be also attachment. It can be the sociometry, which is what we study with the genocociogram. So the affection, the identification with some members of our large family. It can be epigenetic. So I think there are many factors why this information is transmitted across the generations.
sure.
Yeah.
I'm very interested in tapping, okay, the MDR tapping, and I wrote on one of your tests that you are using tapping.
Yeah.
So, can you tell us how do you integrate tapping into psychodrama?
Yes, well, myself, I am an EMDR therapist for 20 years. I was the founder of EMDR Portugal. Together with some colleagues, we created the EMDR Portugal Association. And the bilateral stimulation is like an eureka in the psychotherapy trauma healing, because it creates a brain wave which is healing, very similar to the dream wave. That has also some healing function. So we understand that we can use tapping, bilateral stimulation, like the butterfly hug, during psychodrama or in many other expressive methods that we use in transgenerational therapy, not just psychodrama, like writing a letter or making a collage or other methods, even dance. But you can combine it with body therapy, because we know from trauma experts more and more that the trauma is in the body. So psychodrama is also a body method, but we need to go deeper with this kind of memories. And it works. It really works, yeah.
I wrote that you match it with psychodrama, so I was very interested in that.
Yes,
That
whether it is one-to-one therapy or in group setting. So it can be group therapy or one-to-one. We always can use the tapping. If you are an EMDR therapist, then you can also use eye movement and other bilateral stimulation, but the tapping is quite accessible for everyone.
Sure. Last question. Can you tell me what are the main characteristics of bipersonal psychodrama in your method? How do you use it? How do you deal with bipersonal psychodrama?
Well, I just wrote an article recently for Springer, a very big scientific publisher, on bipersonal psychodrama and psychodrama. there are many things to talk about it. I mean, I'm a psychotherapist. I'm not just a transgenerational psychotherapist. So we can use the empty chair. We can use even the therapist playing the role of the antagonist. So let's say if you have an issue with your grandmother, I can say, I am now your grandmother. I know I don't look like her, but you are now going to speak to your grandmother, whatever you would like to express to her. And then we will role reverse and have all the psychodrama techniques like thinking aloud or the mirror
So
or
you
even
take
the
the
double. Hmm?
sure. So you take the role of the
Yes,
antagonistic.
yes.
Okay,
Yes, I was
that's
trained
the
by
point.
Fonseca in Brazil that we take the role, yeah. But it's not compulsory. There are other techniques. We can use the toys to do psychodrama. We can use the empty chair, or in a
Sure.
group setting. Of course, the therapist does not need to play a role. Yeah.
Yeah, the point was that I was interested in knowing if you play the antagonist role or not,
Yes.
because of course here in Italy we have different techniques, but that one of playing the role is a little bit, how can we say, not all the therapists play the
Yes,
antagonist
absolutely.
role.
It's more controversial. I was
Yeah.
trained by a psychodrama that is actually also analyst, José Fonseca, who wrote extensively about personal psychodrama, is a Brazilian psychiatrist. And we will demonstrate this during this workshop and eventually have the participants practice it.
Okay, so thank you very much. We we really
Just one more thing. We will also cover what has been written in our most recent book. It's now in Portuguese, but it will be translated in Italian and English. We repeat what we don't repair, where it speaks about all the psychogenealogy phenomena,
hmm.
like, invisible loyalties, anniversary syndrome.
Would you like to add something more about transgenerational therapy, which will be the theme of our workshop? It's up to you.
Yes, about this theoretical part, I feel it is important that people are more informed about what has been studied in these phenomena, the transgenerational phenomena, the psychogenealogy phenomena, like the replacement child, the anniversary syndrome, the invisible loyalties, because even now there are other methods like family constellations or many others that benefit from studying these phenomena, having a more consistent approach, but also especially for people who are psychodramatists or want to learn about transgenerational therapy. They should know about the theory, not just the practice. Nothing more practical than a good theory, Anne used to say.
Thank you so much. Thank you so much for this interview, and I'm really happy to see you in November in Milano in Teatro Trebro. Okay, thank you
Yes,
so
thank
much.
you. Thank you, Louisa. Very happy to be there in November. It's still recording.